Hello, good morning. This is Dega King, and this is a quick webinar that I put together to go over the 12 breast health interventions. Before we get started, I just want to read this quick disclaimer. So the information provided here is for educational purposes only. It is not intended as a substitute for advice from your physician or other healthcare professional. So my name is Deka King. I'm the owner of Bras Thermography and Wellness. You've seen me here in the office if you come in for a thermography or breast consult or even holistic cancer coaching. So these interventions can significantly improve your breast health if implemented along with dietary changes. So just let's go ahead and review these. So if you've been in our office for thermography or any other breast health consultations or even our holistic cancer coaching, you probably received this document, a document with the same name. This is just an expansion of to further explain each point that was provided on the document. So the first intervention is to exercise. So this seems very easy, right? Easy enough, but we find it very difficult to move around our schedule to find the time to exercise. So it can be a bit of a struggle for some of us if you have a busy schedule. But exercising has an undeniable benefit. So, exercising 40 minutes a day or at least 4 hours a week can reduce breast cancer risk by 60%. And it can also help prevent breast cancer recurrence or even breast disease as well. So, intervention number two is melatonin. So, why increase melatonin levels? So, one of the things that we have to understand is when we have estrogen in our body, these estrogen have receptors that they bind to, right? So one of the things melatonin is able to do is able to inhibit any receptor signaling for cell division, meaning that if we have an estrogen that sits in that receptor that is a strong, what we call xenoestrogen, it can cause cell replication. This is how tumors develop, right? Because we have a crazy cell division going on. What melatonin does, it inhibits that from happening. So melatonin is important in inducing what we call apoptosis or cancer cell death. And this reduces breast cancer invasiveness and metastasis, right? Because if it can replicate, then you cannot have metastasis, you're going to have a tumor growth. Okay. So higher melatonin is associated with lower risk of breast cancer for that reason. One of those reasons. Melatonin also inhibits an enzyme called aromatase. So aromatase, what it does, it converts what we call androgens in fat cells into estrogen. So unfortunately, menopausal women have high levels of androgens. And this is the primary source of their estrogen in menopausal women. So inhibiting aromatase can significantly lower breast cancer risk in women because we're reducing that amount of estrogen in their system. So how do I improve my melatonin level? So sleeping in a dark room, wearing an eye mask, using night lights through the room. I like using like plug-in night lights. I like using the blue ones. And the reason is melatonin is excreted at night. Okay. So if your melatonin is highest at night and you flick on that light, your melatonin will drop. Okay. So melatonin is really protective. So we need to be able to protect our peace at night, our dark at night, so that we can have good melatonin levels. Intervention number three has to do with vitamin D. So studies indicate that women with low levels of vitamin D, they tend to have more advanced breast cancers, while women with higher levels of vitamin D do not. Okay. So vitamin D has benefits for both prevention and improving the prognosis of breast cancer. So one of the things that I will sometimes have ladies do in the office is check their vitamin D serum level. That's in the blood. So breast cancer incidence is reduced by 30% when a serum level, the blood level, is 34 nanograms per milliliter versus the baseline, which is what the expectation is from our medical doctors, is 25 nanograms. They're okay with that. But if you can bring it up to 34, it reduces your chances of breast cancer by 30%. And if that same level that you measure is at least 50 nanograms per milliliter, you reduce your incidence of breast cancer by 83%. So you always want to be above 50, right? The higher, the better. Just remember that. Also, the best way to get your vitamin D is through sun exposure. So the best time to do it is between 10 a.m. and 2 p.m. You want to make sure you lay out and your arms are exposed, your legs are exposed, and then make sure that you keep that sweat from being in the sun. Hold on to that for at least 20 minutes. Do not just sit out there for a few minutes and then go wash it off, because the benefit comes from the absorption of the vitamin D. So let's just go ahead and sweat, keep it on, and then just absorb it. Wait a while before you take a shower. The fourth intervention has to do with adopting a plant-based or vegetarian diet. Okay. So, vegetarian or plant-based diet is the start in improving serious breast conditions because it can reduce what we call oxidative stress. And this is usually caused by external things coming into our bodies. So, we're talking about other foods that we eat, or lotions we put on, or shampoos we use, or any of those things that come into our bodies. They're xenoestrogen, they're external estrogens, and they can increase oxidative stress. So, having a plant-based diet can reduce that. So red meat is actually considered a group 2A carcinogen according to the International Agency for Research on Cancer. So foods that are plant-based have less of that substance that a cancer needs to survive and replicate. So we need to make sure that we're eating a little better plant-based diets. The fifth intervention is really has to do with what we call phytoestrogen. So in this case, we're talking about a freshly grounded flaxseed. It's really effective or really good for protecting against breast tumors, and it helps to prevent metastasis. Why this happens is because, once again, it's plant-based, it's phytoestrogen, and selenium is also beneficial because it starts the cell destructive sequence in cancer cells. So you can get selenium by eating Brazil nuts. It's really, really important that you do not overdo the Brazil nuts or overdo selenium. There's a certain level at which you need to stay on, and anything over that can really do the opposite of what this is meant to do. So it's really, really important that you're monitored. So I just want to explain phytoestrogens or plant-based estrogens. Those are weaker estrogens that can sit on the receptors and stop cell replication, where xenoestrogens are external fake estrogens that come into our bodies, into our cells, and they cause cell replication. That's not what we want. The sixth intervention is basically adding turmeric or curcumin daily. So, curcumin is also a phytochemical or phytoestrogen, and this is found in turmeric. So, like curry, basically. And this is known to decrease oxidative damage to cells and inflammation. This also interferes with the growth factors that stimulate breast cancer cells and then help reduce tumor growth. So turmeric is really, really beneficial. Just make sure that when you do turmeric or curcumin, that you're eating that or adding black pepper, because that improves the absorption of the turmeric. Okay. The seventh intervention is the reduction of alcohol. So alcohol is considered a group 1 carcinogen according to the International Agency for Research on Cancer, and that means it is absolutely a carcinogen, no ifs, ands, or buts. It will cause cancer. So research also shows that drinking more than 3 drinks or alcohol beverages in a week will increase your chances of breast cancer. And one of the reasons is because that will interfere with your liver's ability to remove environmental toxins or chemicals from your liver. So that's really, really important. Your liver needs to be able to function to remove a lot of this junk out of your body. And if alcohol is interfering with that, then of course you're accumulating that into your body, your cells, and then therefore affecting the replication of cancer cells. Intervention number 8, switching to a non-toxic product can also reduce toxic burden on the liver in order to properly remove carcinogens from the body. Once again, if the liver is congested, things will back up, right? So we want to avoid cleaning products with chlorine. There are companies out there that actually sell natural products. One of them is Branch Basics. I personally like using baking soda and essential oils to like vacuum or wash clothes or things like that. So there's things that you can do naturally where you don't have to rely on external toxic products or substances, because once again, they will get into your cells. You will absorb those things and they will affect your liver. Therefore, it will increase the replication of cells. Intervention number 8 is finding ways to decrease, once again, environmental factors that can affect our breasts or health in general. And one of the ways to do that is reducing things like bisphenol A, right? This is stuff that found in plastic. Phthalates is another one. And the reason is they can act like estrogen when in fact they are not. They're xenoestrogens, like I explained earlier. Xenoestrogens are like pseudoestrogen. They're fake estrogen that pretend to be estrogen. And when our bodies are over estrogenic, then that's when problems can begin. So this can be harmful to us and can increase the chances of developing cancer. So it's a good idea to store a lot of our foods in glass containers. If you go out and get a drink, and make sure that you have like a thermos or a glass container, cup or glass or whatever to put your drinks in. Don't leave them in those plastic cups or paper cups, because they all have some sort of chemical that allows your drink to stay in there, not seep through paper. Okay. So just make sure that you travel with something that you can transfer your drinks to. Intervention number 10. So according to the International Agency for Research on Cancer, there are certain birth control products are considered carcinogen. There are also some hormone replacement therapy agents that fall into a group 1 carcinogen, which means they are known to cause cancer. So it's really important if you can go to the website or Google International Agency for Research in Cancers and look for group 1 and group 2A or group 2B list, and you will see some of these products on there. So you need to avoid using birth control or hormone replacement therapy. The way that we deal with this in the office is if someone has symptoms, and we address the symptoms. We don't want to give anybody any products or anything that will induce cancer cell replication. So hormone replacement therapy used for 5 years also increases the risk of breast cancer. Once again, it depends on what kind of hormone replacement therapy you're using. And like I said, it's also important to address some of the symptoms just naturally. The 11th intervention has to deal with, once again, some sort of xenoestrogen. These are things that are come from external substances that we put into our body. So cosmetics are filled with carcinogens. So because they're not regulated, it's important that you avoid them or find better products. You can always go to the ewg.gov website or cosmeticbase.com website. You can put in like the brands of the cosmetics that you're using or ingredients from cosmetics that you're using, and see if there's any of those substances on that list for as listed as carcinogens that you should be avoiding. So intervention number 12, you need to spend at least an hour a week in saunas. This is a great way to eliminate environmental toxins or chemicals from your fat cells. So usually we recommend the infrared because that's the best way to remove things from inside, like because it goes pretty deep into your tissues and you can remove toxins and metals and all kinds of junk from your system. When we have clients who are coming in for breast cancer, we usually have them do 150 hours documented of infrared therapy. But of course, with that, there's certain supplements you need to take to help remove the toxic load that you're dealing with, not just have your body just be so stressed from doing it. So there's certain things that you have to do, not just go in there and do 150 hours. There's certain things that you need to follow. The size of your breast is determined by the amount of fat contained in it. So remember, toxins are fat soluble. So the more fat that you have in your breast or your stomach or any part of your body, the more toxins you have because they're fat soluble. They go straight into your fatty area. So sweating allows the removal of a lot of the toxins, especially environmental chemicals that you're putting into your body. So just a quick note, although there are quite a few interventions listed on here, um, start anywhere, pick one and start there. These are good starting points. There's certain things, of course, you can change if you've done hormone replacement therapy. All you can do is try to remove some of those toxins out of your body. If you've taken birth control, once again, same thing, try to remove those things out of your body. by, doing infrared therapy or things of that nature. Any changes that you make will reduce the chances of developing breast cancer. So implement anything, but obviously implementing more than one or several will exponentially improve your breast health. Okay, so just start anywhere. So if you have been to our office for thermography screening, you receive a prevention booklet. It's really important that you use it. Many times we give the prevention booklet, I review some of it, but then it's put to the side. There's valuable information in those booklets. Put it to use. And if you're not, give it to a friend who might put it to use. You might be saving their life. Okay. So breast cancer is too prevalent for you not to use the resources offered to you. Once again, if you have a daughter, an aunt, a cousin, anybody, this is an opportunity to save them from any devastating disease such as breast cancer by educating them. So help them make a change now so that, they don't have to deal with these things later in life. So once again, doing something is better than doing nothing at all. All right, you guys, if you have been in our office, you know how to contact us. If you haven't, if you're watching this because somebody shared it with you, call our office if you need to schedule a thermography or if you need breast health consultations. We handle benign conditions like calcifications and fibroadenomas and nipple leakage, fibrocystic dense breast, but we also deal with a lot of invasive cancers, estrogen positive cancers, and all those things in our office. So I'm also a holistic cancer coach with beatcancer.org. So just know that we can help you here with these situations. Okay. All right, you guys, that's it. Thank you so much for sticking around, listening, and hopefully you've gotten some valuable information that you can share or you can take on yourself to help improve your breast health. You guys have a great day. This is Deka King with Ross Thermography and Wellness.